The new flu variant is driving an early intense flu season overseas and could signal a rough winter here. According to doctors, the variant can cause more severe symptoms like high fevers, body aches, and extreme fatigue. Joining us to talk about this and other health topics, who else would it be? It's Dr. Jeff Pothof, UW Health Chief Quality Officer. Doctor, great to see you. Are you worried about this new variant?
I think it could cause some trouble. Like you mentioned, it's not quite in the United States yet, but when we made the flu vaccine, they look at what happens in the Southern Hemisphere, and the companies nailed it. They got H3N2, but then the flu virus is like, well, wait a second, I'll just mutate 6 or 7 times. And that mutated virus, one, is causing a little bit more severe symptoms, increased hospitalizations, especially in those who are immunocompromised or elderly. If there is a silver lining, the flu vaccine's still pretty effective. It lost about 10% of its effectiveness. But, we could be in for a little bit of a rough flu season when it gets here.
Yeah, so the new variant, obviously the flu vaccine won't protect necessarily against that. Is there anything we can do to protect ourselves?
Well, the flu vaccine will protect to some extent, but I think other things that we can do is, we can wash our hands. We can stay home when we're sick. Keep our kids home from school when they're sick. I know that's a hard one. And certainly if you are someone who's going to particularly have a difficult time, you're immunocompromised, cancer patient, transplant patient, as those flu numbers start to show up, donning a mask out in public is not a bad idea if you're going to be high risk for severe disease.
In years past, when the flu season arrives, it arrives kind of like our in-laws on Thanksgiving. Like the door kicks open, we're here, and bam! It just spikes instantly. Where are we right now? What are we seeing in Wisconsin healthcare systems?
Well, right now, there are isolated cases of flu, but I'd say the door's not kicked open yet. I think one thing that has us a little bit worried this year is with the government shutdown, with the decrease in staff at the CDC, kind of those national monitors that might let us know that it's here, they might be a little bit delayed. It might be more state public health departments, large health systems that start to sound the alarm on the flu having arrived.
We'll know when we send our kids to school, and we'll be like, where is everybody?
You're not wrong.
Yeah. I thought this study was interesting, switching gears here. Sleep apnea could lead to Parkinson's?
Yeah, this was interesting. So this is a study that was a data mine of 11 million veterans. And it's really interesting. So they followed these veterans over the course of 5 years, and those who had obstructive sleep apnea that wasn't treated had a much higher incidence than Parkinson's disease. I think a good way to frame it is if you have sleep apnea, the number of people that we need to treat who have sleep apnea to prevent 1 case of Parkinson's is only 439. That might seem like a lot, but if you look at the thousands of people who have sleep apnea, it's a small intervention to get on the CPAP to prevent Parkinson's just a little bit later in life.
Yeah, what would you tell people? I mean, something to talk to your doctor about? Because a lot of it was the untreated cases of sleep apnea.
Absolutely. If your spouse is hitting you, telling you to stop snoring, you wake up and you're completely not rested, go and talk to your doctor, get a sleep study. I think a lot of people are surprised to find out that they do have sleep apnea. It's something that we just don't think affects us, but a lot of people are affected.
Last question for you. White meat or dark meat?
Oh man, white meat, but you got to make sure you don't dry it out. Like, don't dry out that turkey.
It's tough because I usually am in charge of the turkey, and every year I apologize to everybody. He's like,
yeah,
you guys
just
were talking
more
to
gravy,
me. I lost
Ben.
track of the
more
turkey.
Gravy. You can fix it with a lot of gravy.
Have a great Thanksgiving. Thanks, Dr. Potta. Appreciate it.